afternoon. My name is Dr. Christina Brown. I'm a board-certified pediatrician practicing in Baltimore, Maryland at the Kaiser Permanente Center in White Marsh. I'm also a mother of two. I have children entering first grade and second grade, so this back-to-school topic is important to me as well. I'm grateful to be joined by my incredible colleagues, Dr. Mutsa Nyakabauto and Dr. Asha Patton-Smith. We're excited to be talking to you all today. Thank you.
Excellent. Thank you so much. We're super excited to be here. My name is Asha Patton-Smith. I am a board-certified child, adolescent, and adult psychiatrist, and I work in the Northern Virginia service area in both Falls Church and Burke. Happy to be here.
My name is Dr. Mutsa Nyakabauto. I am a board-certified pediatrician and father of 5 here at the Ashburn Medical Center. So definitely have my hands full and in loving every minute of it.
Great. So we all know it's that time of year again. So time to start talking about back to school. So and for those of you on Facebook, please enter your questions in the comments. We're happy to help answer them. So some schools have already gone back to school, especially in other states. Some are going back next week, some right after Labor Day. So we're here to answer all your questions and provide expert tips for a smooth and successful transition. So Dr. Patton-Smith, I'll start with you. So I know my kids have been staying up way too late recently. We're definitely off of our normal school schedule. Can you speak about the importance of routines and how you recommend to get on track?
I really can't say enough about how important routines are, really. Structure is everything, and that's for all of us. And so the summer is a time to kind of reset and unwind. And yes, obviously bedtimes are different. Then school starts, and since sleep is so foundational, it is needed for overall general growth, both mental and physical growth. It is needed for focus, concentration, for maintaining mood. All of that is extremely important. And so if school's already started and the sleep cycle hasn't gotten back on track, that's okay. It's never too late. We need to start now. Ideally, it takes a couple weeks to shift the sleep cycle, but a lot of us don't have a couple weeks in summer and life happens, so that's okay. What we recommend is start as much as possible. If you haven't started school yet, depending on what time the ideal bedtime is, you need to start shifting back 30 minutes each night. If you're running out of time and you do your calculation and kids are supposed to be in bed by 8 for an early morning start time in the morning and they're going to bed at midnight and you only have a few days left, you can't shift in that 30 minutes, right? So you have to work in the time that you have. Really begin ideally about 45 minutes ahead of time to prepare that nighttime routine, get things calm, get off screens, ideally 2 hours before bedtime, even though I realize that's very challenging. What I find works really well is if there can be at least a few times a week, and I know everyone's busy, some sort of shared dinner time. That typically helps tremendously in just discussing the day, getting a sense of how everyone's doing in the household. And my suggestion, if possible, is that time should be a no screen time. So no TV, no phones, and that also is recommended for parents and caregivers as well during that time. Ideally, it's helpful if we have a shared dinner time to all eat in the same vicinity. So I have some people that have a shared dinner time, but then the kids are watching TV in one room and the parents are doing other things. If at all possible, if all could eat and have a shared kind of experience, that can help as well. The other quick things are, ideally, if we don't have uniforms, kids should try to lay out clothes the day before. That helps with the structure, that helps with the routine, that helps with the morning not being so wild. And whatever can be done, if kids take their lunch, to prepare lunch and even some part of breakfast the night before, that can help as well.
Yeah, those are some fabulous tips. I love especially, turning off those screens for meals because I
Yes.
find, that that's such a common habit. And I try to talk to my patients about that intuitive eating, so that if you have the screens in front of you, you're not noticing, if you're full or still hungry and can tend to overeat so much as well, or not eat enough if you're distracted. So for many reasons, keep turning off those screens while you're eating and before bed. But speaking of sleep, Dr. Nyakabauto, some parents ask about melatonin or even Benadryl to help with these routines, help falling asleep. What do you tell your patients about that?
It's definitely something I see quite a lot, especially around this time of the year. We're trying to get that sleep in. Maybe we've been having some later nights and, we're struggling. There's a lot of frustration. And of course, parents want to relieve that discomfort as quickly as they can. And they hear of this wonderful medication called melatonin, and it's typically viewed as an option to try and alleviate those difficulties that we might have with sleeping. Now, what is melatonin first and foremost? It's a chemical that's produced in the brain. As the day goes by, the brain senses that the light is getting dimmer and dimmer and dimmer, and those melatonin levels gradually creep up in the brain. And that's what helps us to start or initiate sleep. Now, melatonin can also be obtained from outside sources, and that's where the medication comes. And the thing with melatonin is it's sort of as it is a medication in a sense, but it is actually considered a supplement because melatonin is not regulated by the FDA. Melatonin itself can sometimes, in some situations, cause some challenges, and that's why it's important to discuss any initiation of melatonin with your pediatrician first. Now, there's no substitute whenever it comes to sleep for a good sleep routine. And Dr. Patton-Smith, my colleague, gave a wonderful, some wonderful considerations on thinking about some things you can do to sort of get that routine in place. Anytime we've tried a lot of these things and we're having difficulty, having a discussion with about melatonin with your primary care can be something you think of, but we usually think of it as something that we use as a last resort and only in conjunction with all of those effective methodologies and strategies that were discussed just earlier. And again, the challenge with melatonin is that in the recent past, there have been some concerns with poisoning as well from melatonin. And that's because being a supplement, there are sometimes variable levels of the amount of melatonin in particular gummies. And sometimes there's some things that are also added into the medication, the melatonin, that might not necessarily be things that parents would think would be added, like CBD and serotonin. So these are some things to think about when discussing melatonin with your primary care doctor, with your pediatrician, because it's not anything that I tell parents you put in your child, it should not be taken lightly and needs some expert guidance. Now, there are certain situations. For example, Dr. Patton-Smith might shed some light. Some kids with autism do benefit from melatonin, and some kids with ADHD do benefit from melatonin. So there's some evidence-based indication for use of melatonin. That's why it's something we want to make sure we have a good discussion about before we consider it, and only after we have tried initial methodologies and strategies to make sure that we are having a regimented schedule to help us sleep by ourselves without having to need anything at all. Benadryl is something else that comes up a lot with my patients and my parents. And Benadryl, being an allergy type medication, has the unintended or sometimes intended side effect of causing sleepiness and drowsiness. But again, with any medication, some kids have a paradoxical activation with Benadryl, so they become more hyper, and that might not necessarily help our cause. So again, please, 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 anytime you're contemplating any of these medications, please talk to your pediatrician and have that discussion and try those things first. That might help before we even need to go that far.
Yeah, fabulous points. I think, the important things to remember, everything that we put into our body can have some risks and benefits. So definitely talk to your doctor about it, especially if you have any questions or you're having trouble getting onto back into that sleep routine. I just wanted to also add, in addition, definitely talk to your pediatrician as well if you're having any concerns about their child's sleep, if they're snoring really loudly, if they're pausing in their sleep at all, if they're choking in their sleep, that could be a sign of a different issue. And so they may be groggy in the day, potentially from some sleep apnea. Kids can also have that as well. It's more rare than in adults, but that can be affecting your overnight sleep and rest as well. So when in doubt, just talk to your child's doctor about it. So we were talking about routines and too many screens and these routines in the summer. Dr. Patton-Smith, can you talk to us about how to like wean off of these screens? I know our kids are spending a lot more time on them in the summer.
Yeah, screens are something that are part of our life. And so even in schools now, I mean, screens are everywhere. And so one of the things we just need to keep in mind is there are some recommendations with regard to screens, and the recommendations that I typically follow are through the American Academy of Pediatrics. They have an awesome website, healthychildren.org, that gives a lot of information on a lot of things. They're very clear on the guidelines with regard to screens. Any child under 2, no screens, period. Obviously, that's not school age, and we're talking about back to school. So the 2 to 5, it should be less than an hour with parental or caregiver supervision. And then anyone over that age, the recommendation is actually 2 hours or less, not including that is used now for homework or other school activities. So it's not just kind of by happen chance. We know that increased screen use can cause all kinds, or be part of what can cause all kinds of issues with regard to mental and physical health. The other part to that, when we talk about sleep and eating, is if you're on screens, you're typically not outside enjoying the weather and doing some sort of mindful movement or fitness routine. Screens take you away from other things that help the body settle, recalibrate, and help your mood just be balanced, as well as the body be balanced as well. So circling back to your original question, just wanted to give some background on how we can start. I think what's extremely important as a parent or caregiver is to be the example. So if you were talking about consistently being off screens and how such and such uses screens too much, you have to understand, parents and caregivers, that you can show kids much better than you can tell them. So if you are mindful of your screen use, especially around your kids, but mindful in general, it can be beneficial to you, and it can also be a wonderful example for kids. What I recommend, especially during the school year, it's a little bit easier to do this, is have some no screen times and ideally some no screen days. So Saturday is a great time to spend time with the family, to do other activities and not use screens. Family game nights, going hiking, all things that don't necessarily require a lot of money, but do require the time to be off screens. The other thing we mentioned earlier is the dinner table. That's a great time to be off screens. If we all eat breakfast together, which I know probably doesn't happen very often, that could be another time. And then continue to transition in that process. And explain to kids, depending on their age, why we're doing this. It's not just to be mean. It's not to ruin your life. It's not to prevent you from communicating with your friends. There really are some medical consequences, and we really want to be mindful of this. And we also know that as kids, we establish patterns that affect us as we move into adulthood. So really getting that firm foundation and understanding the importance of the screen, but also the risk involved of using the screens of any kind, is part of that process.
Yeah, absolutely. They're, our children are watching us, so it's really important to look inside, first and think think hard about, what they're seeing and set that good example. So thank you for all those tips. Oh goodness, with back to school, I also, I'm always thinking about packing lunches and what that routine will look like and how that's different from in the summer. Dr. Nyakabauto, do you have any thoughts about how to reduce the stress around packing lunches?
Yes, this is something that is quite relevant for my family. And the word here is planning. And sometimes that can be quite a drag with all the people, all the schedules, all the things that we need to do. Finding the time to say, okay, we want to make sure that we get something that's nutritious, that's going to give my child the opportunity to function at their optimum while they're in school is of the utmost importance. And I understand as busy parents, it can be challenging. So don't be disheartened if you're finding it difficult. I find it difficult sometimes too. But it's to keep that practice going. So don't be hard on yourselves. First things first, do your best within whatever your schedule is to find time to plan. So some people are week planners. They plan all the meals for the entire week. I salute those people. You are awesome. Some people have the strength, the endurance to wake up in the morning and prepare meals. Some people do it differently. So whatever routine works best for you, find just that time to plan in whatever capacity works best for you. And what's even better sometimes is have your kids have some skin in the game too. Have them prepare the meals with you. How better to model the right things to eat than preparing those things with your children? That is it's a direct and indirect way of showing them that you value your health and healthy eating, and that you're showing them how they can also be healthy and prepare healthy foods for themselves too. With healthy eating, planning for breakfast is one of the most important things as well, because I cannot tell you how many children I see sometimes. Moms, we're rushed. Dads, we're rushed. We're trying to get the kids to school. They might not have as nutritious of a breakfast as we would like. And that is one of it's cliche, but it is for a growing mind, one of the most important meals of the day. It really sets the tone for how much focus, how much attention, how engaged they can be throughout the school day. So making sure that they have a balanced, nutritious breakfast that has your protein, that will enable them to have the capacity to function throughout the day is something very, very important. And if that's not possible, a quick, nutritious, ready-to-go snack like a granola bar can be helpful to make sure that they at least have a good amount of energy as they go through their day. So these are some healthy tips that can be useful for some parents to make sure that at least throughout the day, their children are able to enjoy at least a nutritious and balanced diet. Now, the thing is to be aware of what the school has, if you can, because what options are available at school can help to determine if your child eats at school, what they have, and have a discussion around things that are available to them at school within the cafeteria and outside of the cafeteria, because having those discussions will help them to make more informed choices as they go about their day. I think at this point of my son, who on our school card, I saw one day 3 ice creams that were taken. And this was subsequent days. He was trying to get away with it. But again, having those discussions and monitoring what they're consuming on their day. Because, if your kids are anything like mine, we'll try and get away with as much sugary stuff as we can. And this is one of the things too, with those online accounts, you can control what they can have access to as well. So all of these things come to the elements of planning and having an opportunity where you can in your busy days to make sure that there is some structure that we can rely on to move forward.
Yes, our sons would get along. Mine, I think, was buying some ice creams for some friends as well. So definitely you have to monitor what's there. Yeah, and talk to them about what they're eating and why and what things are going to give their body the best energy to have a great day. And it's also important for families to know, you may be eligible for your reduced lunches or breakfasts at school. So, your school may have sent out an email about it, but also check their website or go into the school, talk to someone about, applying for that to see if you're eligible. Yeah, and I'm always hearing teens say, I don't have time to make breakfast. I don't have time for that. I don't get up in enough time. But you're exactly right. Grab a granola bar, grab a cheese
Yes.
stick, just something to break the fast, in the morning to help you have a successful day. Yes,
Yeah,
and it's hard to focus if you're hungry, you're gonna improve your academic
exactly.
achievement and your mood, if you're having a good breakfast. So speaking of mood, Dr. Patton-Smith, I know some students are feeling anxious about the return to school. Some may be
Yes.
more excited to see their friends again, but some nervous, especially if they're starting a new school or
Yes.
going off to middle school or high school with different expectations. Do you have any thoughts to how to reduce anxiety for these children?
The first thing is to normalize. I mean, when you're starting a new school year, whether you're transitioning to another school, transitioning to middle school or high school or starting elementary school, whatever is happening, it's normal to feel anxious about it. That's okay. That's typical. It's how, as you said, we deal with that anxiety that makes the difference. So I think what's extremely important is know and prepare ahead of time. So know your schedule, go to those open houses. For those that are first in, especially middle school or high school, tour the school at those open houses. Make sure if you're going to use your locker, you can open your locker and know how to use the combination. All those things are extremely important because it decreases your overall stress level in those kind of day-to-day things that are going to come up that you don't have a lot of control over. Make sure that you are aware of whatever supports are available. If you do get anxious and overwhelmed, the school counselor, if you can go to the office, if there's needs for other types of school supports that's more formalized, parents can start meeting with the counselor early to get that information. What's also important is that parents, caregivers, kids, give yourself some grace. It takes for most people 2 to 4 weeks to really adjust to a new school year and really adjust to anything new. So the expectation of the first day going extremely smoothly probably is a pretty high expectation. If it does, it doesn't mean the second or third day is. School's just started and I'm already getting frantic emails for a lot of my parents saying, hey, it didn't go well. What do we need to do with the medication? For my kids that are seeing me for medication, I say, hey, let's take a break, take a breath. There's nothing dangerous here. It's the first day of school. We really need a few weeks to see how someone's able to adjust to make that happen. So normalize the anxiety, understand that it's a part of this process and it's okay. Make sure that you are educating yourself and preparing as much as possible before the school day, giving yourself some grace, giving that 2 to 4 weeks at least on average to adjust to a new school year. And if the anxiety is continuing to build or is not improved, then talk to your primary care provider, if you have a mental health provider, on what other options can be available or what other things the school can do to help things.
Yeah, it's great to prepare as much as you can ahead
Yes.
of time and attend those back to school events. And I was happy to see an email from my children's school last week that they're even offering some mental health services as well. So, each school may be different in that,
Yes.
but definitely check out resources that your school has to offer and work with those guidance counselors to help reduce stress. And I even saw the idea that you could, on the day before school or even a couple days before, pretend it is the first day of school, get up at the time that you would, set your alarm, practice, packing your bag and getting out the door, knowing where your shoes are and everything. And then just go have brunch together maybe, or, do something fun, but just to get you like back into that routine, especially if your child is feeling more anxious about it.
That's
And
such a great point and so key. I have parents that will drive to the school a few days before the kid will go out, go to the door, then come back. So all of those things, depending on your kid, are extremely important. So thank you for bringing that up.
Yeah. And parents can be stressed as well. So I know so we can feel it in the air, with all the back to school things everywhere. Dr. Nyakabauto, do you have any thoughts for parents how to reduce stress?
So again, this flows from everything that we've discussed earlier. Parents get anxiety and stress when things seem unpredictable. So try and control what is within your capacity to control. I take an example from my wife at this point, and I tip my hat off to her, because when the children are stressed out, you're going to be stressed out too. Minimizing their stress in whatever capacity you can will help you in turn to not feel as stressed as well. So some of the things that she has done, laying out all of their clothes for the week so that they're prepared, so we're not rushing out, so that we have everything in place, and when we need to get things that we need to. My son was having a lot of difficulty with the combination, Dr. Patton-Smith, you mentioned that was causing us a lot of anxiety, because we were thinking about him lugging his bags around school all day with all the books that he has. And no parent wants to carry the burden of that stress throughout their workday. That is also stressful too. So having opportunities to make sure all of these things and are put in place to sort of plan ahead and make sure your kids are as comfortable as possible. Also, for parents, having someone to talk to as well. Being able to voice concerns on a forum such as this with other parents too, find techniques that work, talking to your pediatrician. These are all good resources that can help us to make sure that we optimize everything that we need to do. And also maintaining open dialogue with your children throughout the course of the transition, because that open dialogue is so important. You would be surprised what kids will be able to divulge to you when you just say, I'm here. Without even asking or probing, I'm here. Whatever you need, I'm here. And at a point when they are comfortable, they will start to open up to sort of let you know what their concerns are and what they need from you as a parent to help them be as successful as possible.
Yeah. Love it. And we were talking about, recognizing our own screen time use. We have
Yes.
to look inward about our own feelings and come back to the basics, right? As parents, are we eating breakfast? Are we getting good sleep? Are we getting physical activity in
Yes.
our day? So that we can be, the sturdy leader for the family and make our own best decisions. So
Absolutely. And
great.
And with our little ones, more than what we say, they see what we exemplify through our actions. And if our actions show that we do not have the same sort of planning, or we are anxious or worried and how we cope with those situations, it might show them how to address similar situations too. So they learn more by us finding those coping skills to be able to navigate the challenges in our lives. And that is a very challenging thing to do, because there's a lot that's stressing us out. But they learn really well from our example. And if we're able to employ some of these things, we'll be able to make sure that they see them and they replicate them as well in their lives.
Exactly. Can we
Absolutely.
reflect before we react, and
Exactly.
model that? Yeah. Dr. Patton-Smith, what about, beyond those 2 to 4 weeks and that transition, if a student is still really struggling, like what are some things that parents should look for to know if they need more help?
Absolutely. I mean, just kind of piggybacking on what was said with regard to be available and open to receive whatever information your child is telling you or giving you. No signs. You know your child more than anyone. And so if there are changes in sleep, if there are changes in appetite, if there's increased irritability, if there's persistent social isolation that's different from whatever your child's baseline is, if there are thoughts of not wanting to be around anymore, those are obviously more significant signs. If there seem to be a lot of socialization, a lot of friends, and now there's no one talking about that or figuring out what's going on with that as well. And when you see these things, it's important to track them. It's important not to just ignore them or kind of think them away. And depending on the age of your child, you can just say, hey, this is what I've observed, and just want to get a sense from you of what's going on. And sometimes you get a really logical explanation, and sometimes the child's like, yeah, I'm wondering too. I don't know. I just can't figure it out. At any of those times, those are times when you need to get some additional help, talking to your child's pediatrician if there is a mental health provider involved, or getting one involved, the school counselor, to see if there's anything happening at school that needs to be aware of. Sometimes even when you are seemingly, as a parent or caregiver, having the best relationship with your kids, you're super open, you're doing all the modeling, and you still miss things, right? That's, no one's perfect, and that's part of what's happened. So make sure that you have an open dialogue with teachers and the people at school counselors and other things. Make sure they know who you are. If your child's always going to the school nurse and you don't have a relationship with the school nurse, there may not be any feedback, depending on the school, that your child is always going to the school nurse with a headache every day, or stomach ache, or not going to class until kind of the end of that quarter. And a lot of times there's some things that could be done ahead of time. So don't assume from a parent or caregiver standpoint that the school is going to necessarily come and give you information. Obviously, there's something very significant happening, they will, but some of those softer signs, it's important for you to be proactive and get some information. It's also important, depending on the age of the child, to give teachers, to give school administrators just some sort of background on what your child's like. It doesn't have to be all the medical diagnoses. It doesn't have to divulge confidential mental health information, but just how they navigate things. If there's something that is extremely important to figure out, or that would be helpful for the school ahead of time, especially as they're starting new schools, divulge some of that information. Hey, here's how I deal with my child in these situations. It may be helpful for you. So all of that is important. Obviously, if your child is expressing that they want to hurt themselves or someone else, or giving things away, or saying they don't want to live anymore, those are obviously signs of getting help immediately.
Yeah. Yeah, as you said, parental involvement is key, really being hands-on, monitoring, what your child is putting on social media, or, who their
Yes.
friends are, what they're involved in. Like, parental involvement is key. So that's a great point. This has been a fabulous discussion. We could talk about this all day, I'm sure. It's an exciting topic, and we're all feeling this as we're about to go back to school. But Dr. Nyakabauto, could you share anything else you wanted to add? Any closing thoughts?
Enjoy your time with your kids. Stay close to them, be open to them, and just continue to support them as you always have in all the things that they're doing. We're here to help. As your pediatricians, we want to make sure that we are part of the process. So please, please, please do not hesitate to reach out to us. That is why we're here.
Thank you. Yeah. Dr. Patton-Smith, any other thoughts?
Absolutely. I mean, parents and caregivers, we're all human. We don't always get it right. That's okay. We're a model and example for our kids. And even when we don't get it right, when we take ownership and work through, it's a huge learning lesson for everyone involved. So exactly, enjoy every moment. This is going to be an awesome year this year. Set your goals and intentions, and let's make it happen.
Yeah, great. And as a pediatrician, I'll just put my final thought, make sure that your child is up to date on their vaccines as well. Many schools require certain vaccines, especially going into kindergarten or going into 7th grade. You need that tetanus and meningitis vaccine, as fun as that is to talk about with your preteen. So make sure you're up to date with vaccines. Talk to your doctor now about it. And after September 1st, we're pretty sure that's when we'll have the flu vaccines available. So look out for information coming out about that as well, because it's the best way to keep you and your family safe during this upcoming flu season. So thank you all for joining us. This was a great discussion, and have a great school year.
Thanks, everybody.